6 new facts about COVID-19 that you won't hear from the mainstream media or from public health officials. Since they won't report the latest science and data to you, I will. According to new data compiled by Dr. Andrew Bostrom about COVID-19 infections on college campuses, at 37 U.S. universities, there have been 48,300 positive COVID-19 tests among students. But these infections have resulted in just 2 hospitalizations and 0 deaths. Compare that to the 1,800 annual deaths from alcohol poisoning that happen on college campuses nationwide. According to new data from Brown University, reopening K-12 schools may be less risky than expected. Using data from more than 550 schools, the Brown University team found a small 0.078% rate of confirmed cases among students and a 0.15% rate of confirmed cases among teachers. In fact, the rate of positive COVID-19 tests in schools is much lower than the surrounding community. According to an NPR report, the hybrid model of schooling, where students go into school some days and stay home some days, is resulting in the most COVID infections among school staff compared to full capacity in-person school or remote schooling. These are the numbers. According to this tracking data, schools that are teaching students in person, full capacity, are experiencing staff COVID cases at a rate of 21 per 100,000. Schools that are teaching students remotely full-time are experiencing staff COVID cases at a rate of 24 per 100,000. But schools that are teaching students with a hybrid model are experiencing staff COVID cases at 52 per 100,000. A large study from Scotland finds that exposure to children is protective against COVID-19 for adults. This study examined 300,000 NHS workers in Scotland. The study found, and I quote, "Increased household exposure to young children was associated with an attenuated risk of testing positive for SARS-CoV-2, and appeared to also be associated with an attenuated risk of COVID-19 disease severe enough to require hospitalization." End quote. The significance here is data like this further suggests that there is significant T-cell cross-immunity from common cold coronaviruses, which would significantly reduce the percentage of the population who need to contract the COVID-19 virus before an area reaches herd immunity. According to the latest CDC data on infection fatality rates and survival rates of COVID-19 by age group, if you contract COVID-19 and are between the ages of 0 and 19 years old, you have a 99.997% rate of survival, which equals just 0.003% fatality rates. If you contract COVID-19 and are between the ages of 20 and 49 years old, you have a 99.98% rate of survival, which equals just 0.02% fatality rate. This, of course, according to the U.S. government's own data, is equal to or less than influenza fatality rates for people under 50. According to a new preprint about the prevalence of the COVID-19 virus, the virus may be far more prevalent and far less deadly than we have been told. The study examined 615 adults in Tokyo who were given COVID-19 antibody tests. At the first test, only 6% had antibodies to the virus. But by midsummer, nearly 47% of the 615 adults, nearly half, had antibodies to the COVID-19 virus, despite the fact that not a single person in this study was hospitalized or died from the virus. The scientists conducting the study concluded, and I quote, "COVID-19 infection may have spread widely across the general population of Tokyo despite the very low fatality rate," end quote. Since public health officials, elected Democrats, and the mainstream media refuse to report any of this to you, I will.